Good morning, Southwest Florida. I'm Bri Walling. This Naples Herald Morning Report is sponsored by our friends at Fusillo Kia of Cape Coral. This morning we'll tell you about a push to inflate business incentives in Florida, a baby born to a Texas woman with a uterus transplant, and more. Today is Monday, December 4th, and this is the Morning Report. Governor Scott has yet to dip into the $85 million lawmakers set aside this year to attract new businesses to Florida, but he's already seeking to replenish the pool of money. In a meeting this week, Scott told the Enterprise Florida Board of Directors about the need to ensure lawmakers maintain the new Florida Job Growth Grant Fund, which has attracted 209 applications from governments and other groups across the state since opening in July, but still hasn't indicated when money could be awarded to the first regional or workforce project. His request to replenish the fund with another $85 million is part of his $87.4 billion budget proposal for the 2018 legislative session. Money in the new fund is prohibited from going to projects that provide exclusive benefits to single businesses. In 2016 and earlier this year, Scott was unable to get his lawmakers to approve his request to continue funding economic incentives through Enterprise Florida, cutting off money offered in prior years to attract, maintain, or help expand companies such as Hertz, United Technologies, and Harris Corporated. Read more online. Simply Healthcare Plans made too much money from Florida's healthcare program that treats the poor, elderly, and disabled, and was required to return nearly $1.8 million to the state. The legislature passed in 2011 a law that requires most Medicaid patients, from the cradle to the grave, to enroll in HMOs or other managed care plans. The state pays monthly premiums to managed care plans to provide care to patients, and the plans are required to provide access to all covered services, regardless of whether the cost of those services exceeds the paid premiums. To ensure that the plans don't make too much of a windfall, the legislature included in the law a so-called achieved savings rebate, which is established by determining pre-tax income as a percentage of revenues. Under the achieved savings rebate, plans are required to return money to the state if their pre-tax incomes exceed certain thresholds, and this is the first time in a managed care plan participating in Florida's statewide Medicaid managed care program that had to return the money to the state. Read more at naplesherald.com. The first birth after a womb transplant in the U.S. has occurred in Texas, a milestone for the U.S., but one achieved several years ago in Sweden. The woman, who had been born without a uterus, gave birth to the baby at Baylor University Medical Center in Dallas. The hospital has had a study underway for several years to enroll up to 10 women for uterus transplants. In October of 2016, the hospital said 4 women had received transplants, but that 3 of the wombs had been removed because of poor blood flow. The hospital wouldn't give further information on how many transplants have been performed since then, but Time magazine, which first reported the U.S. baby's birth, said 8 have been done in all, and that another woman is currently pregnant as a result. Womb donors can be dead or alive, and the Baylor study aims to use some of both. The first of the 4 cases involved altruistic donors, meaning they were unrelated or unknown to the recipients. Doctors hope that womb transplants will enable as many as several thousand women born without a uterus to bear children. To be eligible for the study, women must be 20 to 35 years old and have healthy, normal ovaries. And that was the Morning Report for today. I'm Bri Walling. The Morning Report airs Monday through Friday at 9 a.m. right here at naplesherald.com. And don't forget to check out our lunch break that also airs Monday through Friday at 12 p.m. Thank you for watching.